Good afternoon, everybody. I'm Sharon Spurlock, the Senior Director of Family Education at the St. Louis ARC. I'm so happy you've been able to join us today for our weekly Q&A. I think you're going to learn a whole lot about how our region operates with our wonderful directors of our Senate Bill 40 boards. So without further ado, I'm going to start off with some introductions, and we're going to start with Denise Cross.
Hi, thank you. I'm Denise Cross. I'm the Executive Director with the Developmental Disability Board in St. Charles County.
Thank you, Denise. And to Stacy.
Hello, everyone. I'm Stacy Ismail, and I'm the Executive Director for Developmental Disability Advocates in Jefferson County.
Thank you, Stacy. Becky, you're next.
Hi, I'm Becky Hirschbach, Executive Director of the Productive Living Board in St. Louis County.
Shailene, you're up.
Hi, I'm Shailene Plank. I'm the Executive Director for St. Louis Office for Developmental Disability Resources.
Thank you so much. And Shailene's going to pull up a screen and start with a short presentation that I think is going to have a lot of really important information to share.
Here are lovely pictures of us. We've already introduced ourselves, so I will move on to the next slide. So what is a Senate Bill 40 board? So in the late 1960s, to be more specific, 1969, Missouri voters approved legislation, and this was also known as Senate Bill 40 or SB 40, and that allowed the citizens of each Missouri county to vote on a property tax levy that would dedicate funding for support services for individuals with developmental disabilities. So county boards that were created as a result of this tax levy refer to themselves as SB 40 boards. So in Missouri, there are 89 counties that have passed the legislation. Voters in St. Charles County, Jefferson County, St. Louis County, and St. Louis City all passed it back in the late 70s, early 80s. So if you look at this slide, you can see that all four of us, we passed it between 1977 and 1980 to be exact. Three of us started with a 5-cent levy, and Jefferson County started with a 10-cent levy. And then in the 80s, three of us increased our tax levy. So St. Louis City increased it to 15 cents per $100 assessed valuation. Productive Living Board increased it to 9 cents. St. Charles increased it to 16 cents, and Jefferson County kept theirs at 10 cents. And so what this generates for each of us per year is, for the city, it's a little over $7 million. For the county, it's a little over 24 million. St. Charles County is a little over 15 million, and Jefferson County is over 3 million. So each of our boards are governed by a 9-member board of directors. And board members are volunteers, and they're appointed by the mayor or the county executive. Because we are quasi-governmental agencies, we have to adhere to the Sunshine Law. So board and committee meetings are open to the public. If you'd like to attend a meeting, please check our websites for time and locations. Also, just to talk, I forgot to mention, as far as revenue, what you will see on your property tax bills when you look at those, then those are the bills that you get in December. You will see a line on your bill that says either Developmental Disability Resources or Developmental Disability Resource Board, something like that. That is what you are paying to your SB 40 board in your county. So what is the Eastern Region Alliance? So the ERA, as we call ourselves, was formed in 2019, and it is a collaboration between the four SB 40 boards: the city, St. Louis County, St. Charles County, and Jefferson County. So we had been collaborating off and on for years, but really also operating very independently. And we realized that we were funding many of the same agencies and the same services, but we were requiring different information from our agencies at different times in different formats. And so we decided to align our processes, tools, and technology for our funded agencies. And we believed that if we worked together and we focused our efforts on the right things, we could create many efficiencies and increase capacity for ourselves and the organizations that we fund. So our goal was really as you see on this slide, to streamline processes and improve outcomes for people with developmental disabilities through shared standards, funding applications, and reporting systems. So the Eastern Region Alliance is not a merger. It's really an agreement between us that as much as possible, we will align our funding practices, expectations for quality and accountability, our service guidelines, and invoicing processes while still respecting the unique challenges, differences of each county.
So let's talk a little bit about the ERA's impact last year. So $58 million was approved for services throughout our 4 counties. That includes not only property tax revenue, but other sources of revenue that each of us may have, which includes things like interest income and grants that we apply for. And then in St. Louis County specifically, we receive transportation sales tax revenue. So all in, it's 58 million, which is a very big number, and we're very, very thankful for that. But as we all know, there are just never enough resources, funding to serve all the services that folks need. But let's talk about the people. It's really about the people. We talk a lot about money in our work, but it is definitely about the individuals that are getting served. And throughout the 4 counties, over 9,000 individuals and their families were supported last year. If you think more broadly about the services that we fund, you could easily expand that. However, when you think about someone getting employment services, then the funding also positively impacts that employer, their colleagues. If it's a service that we fund helping someone engage in their community, then their friends benefit from those services, et cetera. So while the actual number of individuals themselves is around 9,000, we know the impact is actually much, much beyond that. And we fund over 260 different services throughout the 4 counties, and 74 partner agencies provide those services, most of whom we have long-term relationships with, such as with the St. Louis ARC. And while we are funders, we truly do consider these agencies that we work with on an ongoing basis our partners, because without them, the services just wouldn't exist. And so we're very appreciative of them. In addition to these metrics, we also capture outcomes and indicators at an individual level. And we also capture success stories, because who doesn't love success stories? And we love to include those in our materials and share those with our boards and in our communities. If you would like to see more information about those kinds of impacts, then you can look at our annual reports, which are located on our website. And speaking of services, they fall into 3 primary categories. Independent living services help develop skills needed to live in the community. And those services, as you can see here, include pre-ISLA. ISLA is independent supported living assistance. So when we talk about pre-ISLA, those services help people prepare to live on their own in their own apartment or home. Independent Living Assistance Fund reimburses people for some of the expenses that we know we incur when we move into our own homes. So we all need that new mattress and the new TV, et cetera. So ILAF reimburses folks for those needs. And then supportive housing for people with longer term housing support needs. The second category is community connection, and those services support people in participating fully in their communities in whatever way they choose. So these services include things like community integration. So that's, as you can see here, the camp and socialization services. We have professional services such as counseling and support systems, which support the entire family through services such as parent training or childcare. And then we also have community transportation, which transportation is such a huge barrier. We all know that. Anybody who is trying to access services, that's a hurdle. And so we try to do what we can to ensure there is transportation to the services in this particular category. Employment is the last category we're going to talk about today that we all fund. And this includes services that prepare people for work. So whether that's paid work or volunteer work, we have quite a few employment training services. So we help them prepare for work, These services also help them find the job of their choice and achieve really whatever their employment dreams are, whatever goals they set for themselves. And then we also have funding to support services that ensure people can get to and from their jobs. So we have employment transportation as well. So those are the primary services. And these can also be located on our websites if you have further information or if you have further questions.
Because we receive taxpayer dollars, we are very committed to quality and accountability. We have implemented several tools and processes to help us ensure quality and to demonstrate accountability to our taxpayers. So one of those tools is a partner review process. As Shailene mentioned before, when an agency was getting funding from multiple county boards, they would receive usually an annual visit from each board to kind of audit how they were doing things or take a look at how they were conducting business. Well, one of the things that we realized is that that could be done jointly. So the nice thing is we have reduced the number of audits or monitoring visits that agencies receive if they're funded by more than one board. And we really changed kind of the tone of those meetings to be more of a partner review process where we talk about how are things going, what are your current challenges and struggles to deliver services, what are your successes, etc. And so we have partner review meetings for each agency every other year. So they are now on not an annual cycle, but an every other year cycle. Another way that we ensure quality is to basically go to the services, go watch a service being provided, whether it's in the community or at a facility, and really get a feel for what does that service look like. Are the participants enjoying it? Are they having a good time? Do they seem like they like the service? And so we do try to go out and again observe as many different services as we can. We have some requirements for end of the year reporting. So all of us operate on what's called a fiscal year, which runs from July 1st through June 30th of each year. So for example, right now we're in fiscal year 25. And so in July of each year, the agencies all report some information to us, usually in the form of what we call outputs, which might tell us how many people did you serve, how many units of service did you provide, also in the form of outcomes, which might be, did families report that they had less stress as a result of this activity or this service? Did people find work as a result of this service? Were people able to move out on their own as a result of this service or stay in their own home? And so those are called outputs outcomes and indicators. And so we also gather some information at the end of the year, like how close did the agency come to meeting their targets? So agencies typically ask for a certain amount of funding based on how many people they think they can serve in a certain program throughout the year. And so we again look at that utilization of the services. Did the need for the service actually match what they thought it was going to be? If they had difficulty finding participants for the service, why was that? And maybe what were some of the things that they did to market their program? And so that end of the year reporting is just a really good way for us to take a look at the services and what the needs are for the service, what the results are of the service, and again, be able to report that back to stakeholders through activities such as our annual board meetings, our monthly board meetings or annual reports where we, really report that information back out to the public. And then the last piece, of course, as I think Becky mentioned or Shailene mentioned, we are talking a lot about money, but again, these are taxpayer dollars. So it is really important that we really focus on the dollars that are entrusted to us. And so we do also conduct fiscal monitoring, which means that we all have a team of financial experts who will go out and look at different agencies' financial reports related to the funding that we give them and just ensure that the money is being spent well and that things are following general accounting principles and that the money is again being used for the purpose that it was given. Some people ask us, how do we decide what to fund? There are a lot of different factors that we look at when deciding what to fund. We try our best to assess community needs. That can be done in a variety of ways. Some of us might have focus groups where we ask people to give us feedback about what their needs are. All of us do some level of satisfaction surveys and questions about what needs do people have that aren't being met. We also look at regional trends. So one of the reasons that we also decided to form the Eastern Region Alliance is so that maybe a service that's being provided in one county but not another might want to start in new counties because it's proven to be really successful in the county that it's operating. So it really provides that opportunity for expanding services into other areas. We also, of course, look at statewide and national trends. We're all 4 members of a statewide association known as the Missouri Association for County Developmental Disability Services. It's a really long name. We call it MACDDS. And so that's an opportunity for us to talk with the other Senate Bill 40 boards around the state. And we learn from each other. We learn about successes and challenges and new innovative ideas and ways to create new programs and services for people and to, again, demonstrate that meaningfulness of the different services that we fund. We look at best practices. We want to look at what is the research telling us are some of the best of the best programs, services, practices that are out there. And we really want to be offering the residents in our counties the very best services that they can be receiving. And then we look at what other funding might be available for some of the services. As many of you probably know, the Department of Mental Health funds quite a few services for people with intellectual and developmental disabilities. Vocational rehabilitation really focuses on a lot of employment funding, and Medicaid is a very large payer of services for people with developmental disabilities. We typically think of Medicaid as just a health insurance program, but it really goes beyond that and funds a lot of ongoing community-based services for individuals. And so then we try to use our tax dollars to help fill the funding gaps. Where are those gaps in services that maybe we can help to fund that other payers don't pay for? And how do we also help those that don't qualify for Medicaid? Because Medicaid does pay for so much that some folks feel left out because they don't have access to Medicaid for a variety of reasons. So we really try to look at all of those factors when we are deciding what to fund each year. So how do you get connected to our services? As several people have mentioned already, we all have websites. There's quite a bit of information there, but I think you'll find them all really great, informative websites, lots of resources, and again, just how to contact each of us. We also together have an IDD Gateway resource guide, and that's again just a really great single source of resources that could be used by providers, by individuals with disabilities, by families, to really, again, learn about all the services in one single location. For all of us, we typically use the Department of Mental Health Regional Office to determine a person's eligibility for services. There has to be documentation that someone does have a developmental disability according to state law. And so one way to do that is to contact the local regional office in St. Louis and ask to go through the intake process to determine eligibility. Now, two of the boards, which are the DDR in the city and the PLB in the county, they can also determine eligibility based upon records that you might be able to provide to them. So there is that opportunity with two of the boards. Or you can contact a service provider directly, like Sharon, for example, or any of the other people at the St. Louis ARC or Easter Seals or United Cerebral Palsy or a host of other agencies. You can contact that service provider to basically find out what is the process to get connected to services.
All right, so Stacy just mentioned eligibility, so we might be wondering, what does that look like? When you go to the regional office, this is some of the criteria they will use to help determine eligibility. Basically, it is a qualifying diagnosis, some of which are on the slide here, that is diagnosed before the age of 22. Eligibility also looks at substantial functional limitations that are likely to continue indefinitely in some of the areas that you see on the slide, such as self-care, understanding and communicating language, self-direction, mobility, excuse me, and those kind of areas. Some of you may know us as your case management provider. And while having case management is not required to receive our funded services, some of the ERA boards do provide targeted case management in addition to the funding that we do. Case management providers work with individuals and support systems to create an individualized plan and promote the power of choice regarding services that best meet the individual's needs or goals. You can see on the screen the options in the 4 different areas. The regional office provides case management in all the areas, and then there's also an alternative in each area, 3 of which are our county boards. Case managers can also connect people with the services that the ERA funds, but you also, like we mentioned earlier, you don't have to have a case manager to get our services. So how can you help? Our goal, the ERA's goal, is to support as many people with IDD as possible. And the most effective way that we've found to reach people in need is through word of mouth. So we would just ask that you share what you've learned about available funding and hopefully what you now understand is the good work that we do on behalf of our taxpayers in our areas. To help other people become aware of when they pay that line on their tax bill, it's going for some really, really good use, and we take it very seriously and just try to steward those dollars as best as possible. And then we also just thank you for allowing us to speak at things like this to help educate just who we are and what we do. I think from there, we're open to questions.
Let's start with the tax rate. First, I think that was such an informative presentation, and I just wanted to echo what you all said, in that we really do feel like we're in a partnership with all of you, and we are trying to help figure out exactly what you said, how to get the best possible services to the people in each county that deserve them and need them. So thank you again for that. So in regard to the tax, I think people were surprised that not every county had this service. So they wanted to know if it wasn't passed, to those counties not have access to the same type of resources. I'm assuming they have to tap into some other kind of option.
Yeah, there are a few counties that still do not have a Senate Bill 40 tax. There are occasionally, every once in a while, you'll hear about a county that has just passed the tax. So there are still that are actively pursuing it. And I think, again, a lot of them learn about the benefits of having the tax by, neighboring counties that do have it. And so in a county where there isn't a Senate Bill 40 tax, yeah, they would need to, really be looking at what are the other funding sources that are available. Like we mentioned, the Department of Mental Health, Medicaid, maybe vocational rehabilitation. And there may be some other grants and miscellaneous funds that might be available in those counties. But yeah, it's really a huge benefit for a county and for the people that live there to have the Senate Bill 40 tax.
Becky, did you want to jump in, or did
I-
Stacy
I-
cover it all?
She did. You did a great job. But I will add that this is a unique structure we have in Missouri, and we should be pretty proud of it. Local governing boards, such as the Senate Bill 40 boards, understanding local needs and understanding the agencies that can provide those services is one of 2 states in the entire nation to have a structure like that.
I always wondered that. Thank you for sharing that. The other question about the taxes was just the difference in the rates, and how do you make changes with that? The question is, why isn't there a standard rate across the entire state? Do residents have to vote to approve a tax increase? How would we increase our rate by county?
So it's really decided by local voters when it's put on the ballot. So a certain amount would be decided when it's placed on the ballot. And like I explained in the slide that I shared, 3 of us had it placed on the ballot again later on in the 80s for an increase. And that's when it was increased for each of us. And it was really determined by the voters that they would like to apparently they liked what they were getting from the county boards and wanted to see more services and recognize that there was more of a need. So that is the way it was done for those 3 boards. Now you'll notice in the slide too, which I think is unusual, Stacey's county ended up decreasing the levy at some point, but then realized that they were in need of those services and increased it back to 10 cents. So it is something that does have to go on the ballot if it is needed for an increase.
I think it's also important to mention that there's a mechanism in the state that would prevent a board such as ours from receiving a windfall. So if for some reason our revenue were to increase, there's a mechanism that's already predetermined in statute that says that we have to adjust ours down to kind of match what our current revenues are, plus a little bit of inflationary wiggle room. So while, like, for example, our tax rate says 16 cents, we're currently at about 11 cents because of that.
So I think I'd be remiss if I didn't bring up the fact that there's been some energy in the last couple of years to eliminate property taxes in the state of Missouri. And at the St. Louis Arc, we spent a fair amount of time educating families as to what the consequences of that might be. Do you all have anything that you'd like to add to that? I think the words that you'd like families to know about.
I can take that one. I'll start us off. That's certainly an important topic. And you're right, it's about education, and nobody likes to pay taxes. There is no one who would say, sign me up for more taxes. So I think it is about understanding what services we're receiving for those tax dollars. And I think we've tried to talk a little bit about how rigorous we are in our oversight today. So there isn't a belt to be tightened in our organizations, as is often what people say when they say taxes should be reduced. But we just talked about over 9,000 people who depend on these services. So before there's any discussion regarding elimination of property tax or reduction, there needs to be a really careful discussion about how do we ensure those people still get their needs met in our communities. And those tax dollars were hard won. As Shailene just said, voters approved those taxes a long time ago. And so we've been good stewards of those dollars ever since. And people, again, are depending on those services continuing. So, and we're waiting to see what's happening with the senior tax freeze. That's already going to be impacting some of our counties. While that's not a reduction technically, it's a loss of growth. And we know prices are just going up. So that loss of growth will have an impact on our ability to increase funding to our partners. So I'm sure others will want to add to that, but
Well, and across the state of Missouri, SB 40 boards like ours, or at least MACDDS members, contribute I think it's $122 million to the service system. So it's not a small amount, and it would have a big impact across the whole state. And our revenue source is written into our statute. So it would take an act of legislation for us to get that from a different taxing source.
Yeah, huge impact, and really the cost per resident is pretty low.
Yeah, a little more than $6,000. I think when I did the math really quick when Becky was presenting the dollars, or whoever did that.
Fascinating. So one quick question I know you all could answer is that if I live in one county and one service isn't being offered, but it's being offered in the next county over, is it possible for me to get that service?
Only if that provider applies for funding in that county. So we can only serve the residents in our own counties. Again, while somebody earlier said the Eastern Regional Alliance that we created was not a merger, so it doesn't mean that our county lines are erased and that everybody can receive services throughout the whole region. And again, it all goes back to those tax dollars. They are paid by the taxpayers in our counties that live there. And so they have to be used for people that also reside in our actual county.
the beauty of the Eastern Regional Alliance is that there has been expansion of services into counties where they didn't exist before. So the ARC is one of those, a great example that has moved up to new counties with new services. And if families do have an interest in a service, that they should communicate that so that those agencies know to perhaps proceed with looking for funding if it's available.
Yeah. And I think there are some geographic differences too that make certain services more important in one county versus another. I know that, for example, at the ARC, we haven't pursued family navigation services in St. Charles County because they have a funded resource that's already built into their budget and meeting the needs of the families there. So there's a question about how do you assess your community's needs to determine what's the difference for the need in the city versus one of the other counties?
Well, we recently just completed a strategic plan for the next 3 to 5 years where we did, I had a facilitator who hopefully that allowed people the freedom to really say what is real without worrying about talking to one of us. But do some focus groups, do some surveys, do some interviews. We also twice a year hold public hearings where the public can come and tell us about what their needs are as part of our board meetings. And then just the strong partnership with the providers that we fund. I think we learn a lot through them. We also have a really strong self-advocacy group that in People First in St. Charles that we really ask them, like, what are your needs? What are your experiences? And really help appreciate the guidance that they give us as well. That's St. Charles.
I would add to that our family navigators track the information regarding why people are calling them for assistance. And so we received needs data for almost 500 families last year. So that, in addition to the regular calls we're getting that we're tracking and emails to our websites, help us stay informed, as well as Denise said, talking with the agencies. That's the best way of understanding local needs.
Excellent. You've got a really good, diverse group of people. And I think one of the things that I can share with our families is that based on those assessments, sometimes there'll be a request for proposals. Can one of you explain like how that process works, how you decide, oh, here's this opportunity we want to provide to our organizations?
Well, I think that when we identify an unmet need, that might be an opportunity for a request for a proposal where we've heard from the community that I hate to even say it, but we all know transportation's an issue. That's one possible area where we could put out an RFP for somebody who has a unique and creative idea to help solve some of those issues. Just as an example, not saying any of us are doing that right now. But...
No one will hold you accountable, Denise. Promise.
Yeah, but that's an example. Did that answer the question? Or
It did.
y'all see it
That's very
differently?
helpful.
And I would say as far as unmet needs, I mean, affordable housing is an issue everywhere, but it is especially an issue in the city, affordable, accessible, and safe housing. And so how we have or are trying to help with that unmet need is that it is part of our funding announcement. It has been for the past couple of years. And doing housing projects is not something that is neat and tidy and fits within a particular month of a funding cycle. And so we are willing to look at requests as far as housing development outside of our normal funding cycle. So, we are looking at trying to address that unmet need in creative ways.
And I think the beauty, Becky alluded to the beauty, one of the beauties of the ERA is that we learn from each other and what's working in one county that might really work in another county. But I think the other aspect is that we still all operate independently and responsively to our own communities. And Sharon, you kind of alluded to that a little bit with your comments, but it allows us the opportunity to really meet the needs in our particular community as they exist in our communities. And the RFP process might be one of those ways.
Thank you. Really good answers, y'all. What would a family expect if they came to one of your open meetings? What's that like?
It's awesome, right? It's
It's a rocking good time.
right. So we have committee meetings where the majority of the work is done. So the deeper discussions typically are held at our committee meetings. And then the board meetings are a summary typically of what occurred in those committee meetings and the final votes. There is an opportunity for the public to speak during the board meetings if they have a comment of 3 minutes or less on any topic. So the community is welcome for certain to the committee meetings and the board meetings. In St. Louis County, we always have people attend, so you won't be sitting by yourself. And again, we would introduce ourselves and be interested in inviting you to meet the board members as a taxpayer.
And I think you'd have the opportunity. I'm not sure if we all have a virtual attendance opportunity. I know we do. Is that the case? So that's an opportunity too, to listen into the meeting. But I think you would have the opportunity to listen to our board members really dig in deep and do the hard work that governing this amount of tax dollars takes. You'd see them struggle with some of the same things that you're probably struggling with, and just how do we meet the most needs with the money that we have. And they take it really seriously, and it's a lot of work that these volunteers do.
Yeah, I mean, accountability and transparency is really important to each of our boards, and you would get to see that for yourselves, that the work, they take it very seriously, as they should, and that we're doing our best to be good stewards of those dollars.
Yeah, and I feel like at least part of each of your boards are people with lived experience, family members, people that have utilized services perhaps at some point. So so it's not a threatening environment. It's a very comfortable, welcoming space. So if you haven't gone to a board meeting, you should. And you'll get to see so many people from the ARC there. I always feel we're overrepresented.
Yes, it's actually part of a state statute that 2 of our board members have to either have a disability or have a family member with a disability.
We're running low on time. I want to ask one more question at least. Somebody asked if you were all appointed to your positions by the county executive, the mayor, whomever. How does that work?
No,
No, we're actually hired by the board of directors for our organizations. So they are appointed by the county executive, or in the case of the city, the mayor. But we interview for the positions and are hired by the board and then report to the board. And our primary purpose is to run the day-to-day operations of the organization and do all the things that we've talked about, try to set up a system of, receiving and expending the tax dollars and the processes and, you know, all the things that go into running a business. And so, yeah, we all were fortunate to interview and receive these wonderful jobs that we really enjoy.
Excellent. And did you say that the entire board is appointed by the counties that you're in?
Yeah, as Shailene mentioned, our state statute does govern to some extent who needs to be on the board. But they are appointed by the county executive, and it's all 9 members. And that process works a little differently in each county. You know, sometimes we may propose ideas to our county executive of people that are interested in being on the board and what they can bring to the board in terms of like their skills or their knowledge or their expertise. And in some cases, it's the county executive or the mayor or the county council that approaches us about here's someone that's really interested in being on your board. And so it just really varies what that looks like from county to county, but they do have to be officially appointed by the county executive.
I just want to thank you for spending this time with us today, giving us a really, really thorough overview of the ERA. And am I right that we are the only group of SB 40 boards that have come together with this kind of alliance? I'm just so proud of our region, and I'm so grateful to you all because it's really changed a lot of the work that organizations have to put in to go through to do the work. So thank you very much. These are some hardworking folks who are really good stewards of your dollars.